Dr. Richard Besser, former acting director of the CDC and longtime medical voice here at ABC. He now runs the Robert Wood Johnson Foundation. Always great to have you on, Dr. B.
Nice to be here, Lindsay. What an inspiring story that was.
What an inspiring story indeed. We'd like to talk to you a bit about the tricky balancing act that hospitals are doing as they try to battle coronavirus while also dealing with other typical ailments.
Yeah, I mean, that's a major challenge. When there's a new pandemic, a new emerging infection, the other conditions that people have don't go away. And so just thinking about the challenges that are there for people with diabetes and heart disease and cancer, and think about the particular challenges that lower income people have, that people have in rural communities or Indian reservations, they're going to be really challenged to get the care they need during a time of crisis.
Here in New York, the nation's coronavirus epicenter, yesterday Governor Cuomo was cautiously optimistic that the hospitalization was coming down thanks to our social distancing. But then today, we learned that in just one day, New York's hospitalization rate shot up by 40%. What do you make of that? And was yesterday's good news simply kind of false hope?
Well, I think it's a little early to either declare victory or defeat. You know, this is a long game. It's going to take a long time for this to develop, and the numbers are going to be very odd until we have sufficient testing out there to really be able to say what's going on in each community. You know, as we talked about once before, a pandemic is a series of local outbreaks occurring on different timelines. So New York is seeing a lot more activity than other cities. They're going to see this, but until we see widespread testing, a lot of the numbers we see are going to be affected by the number of tests that are being done, and rather than the true spread of the disease. So
how and when will we know if social distancing is really working?
Well, I think some of that does, again, come back to testing, being able to see that, being able to get the word from doctors in hospitals in terms of do they have beds, do they have enough equipment, can they meet the needs? Without really good data and without us hearing from the public health scientists who really know how to model this and track it and really look at those numbers, it's going to be hard to say. But in any infectious disease outbreak, though, there's a lag, which can make it even harder. From the time you're exposed to the time you're diagnosed as a case, that can be on the order of a week. And so you may be making progress, and it may take a good week for you to be able to say, wow, what we're doing is having a big impact.
With hospital supplies running low, today the governor of New York announced that hospitals can split ventilators, use one machine for 2 patients. How does that work? I mean, is that safe?
Well, you know, it's not something you would want to do outside a situation of scarcity. But in a situation of scarcity like we're in now, and you don't want to overstate scarcity. I was hearing in other reports that there still are ventilators available, but you can see where we're headed. We're heading to a situation where there's tough decisions that are going to need to be made. And if it's possible to take one ventilator and have it support the breathing of more than one patient, that would be terrific, and might buy us some time until there's additional protective equipment, additional ventilators, additional material to go around.
There's a lot of confusion about what to do if you've recovered from COVID-19, when you can come out of isolation, for example. ABC's Kaylee Hartung had the virus and told us that she's been getting mixed messages. I mean, can you tell us about the new guidelines that the CDC just put out as far as when you, in theory, are no longer contagious?
Well, you know, some of the challenge here is that the science is still developing. The hope is that after you've had an infection with COVID-19, you can't get it again and you'll be immune. But we won't know that. We won't know how long protection lasts for quite some time, given that it's a new infection. It's important here to follow the guidelines of the CDC, of local health departments, so that you're not putting other people at risk prematurely.
Dr. Besser, always great to have you on. We thank you very much for your knowledge.
Thanks so much, Lindsay.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.